So our speaker for today is Dr. Samia Latif. Dr. Latif currently works as a consultant in communicable disease control at Public Health England, where she also chairs the Black, Asian, and Minority Ethnic Network. Alongside that, she is an assistant academic registrar for UK's Faculty of Public Health and a member of the faculty's Global Health Committee and special interest groups on Pakistan and mental health. A general medical council appraiser and educational supervisor, as well as an accredited mentor, Dr. Latif's areas of interest include global public health, health protection, and public mental health. She is a keen advocate for gender and race equality as well. Today, Dr. Latif will be drawing on her expertise and experience to talk about the art of language and its role in building resilient post-COVID communities, a topic that's really relevant to all of us today. We're all very excited to hear what you have to say, Dr. Latif, and the stage is yours.
Thank you very much. And thank you for the very kind introduction and very generous introduction. I just need to make a disclaimer at this point that any views or opinions I express are my own and not those of my employing organization. So I'd really have to set the theme there. Right, so when Aisha asked me to talk today, I thought about what it was that I wanted to talk and drawn my experiences from having dealt with COVID-19 in the UK. And we have, as you all are, we've all been very busy with this COVID pandemic. And there's one thing that keeps coming back to me time and again, and it was the importance of language and how we communicate with others. And this is not just at a professional level, but at a societal level, at a community level, at a personal level as well. And there's been various instances where I've encountered people in my social networks, in my professional networks, where you sort of, everyone isn't on the same wavelength, and you sort of realize how important it is for the message to be conveyed. Now, language, I think humans, out of all of God's creation, we are blessed in that we use logic and we use language to communicate with each other in a more developed and systematic way than other members of God's creation. So it's really important. It's a really important feature, and I think whether you are a healthcare worker or not, the importance of language can't be understated. So I just like to sort of start with what it is, not what language is, but what happens when we communicate. So when someone communicates, you often have the person who is communicating, the communicator, and then you have someone who is receiving the communication. So he is or she is the recipient of that communication. And then you have the mode that you have used to communicate. And often enough, especially in healthcare and in more scientific and academic circles, language is often used in the form of words and in the form of text and in the form of publications, and not enough attention is given to language being used in more creative ways, and so that's where I'd really like to come in. What really interested me is I was reading about how China dealt with this issue, and I haven't seen examples of this elsewhere, but I haven't really looked hard enough. So there may be examples in other countries, but when coronavirus hit China, and we know that Wuhan was China was the first place where corona sort of happened or emerged. They set up a rapid linguistic response to support their healthcare workers, and they actually have sociolinguists there who were brought in, and they applied all the knowledge of what they knew about the COVID-19 epidemic, highlighting the importance of emergency linguistics. So this is a specialization where language is used and communication is used for disaster preparedness and emergency preparedness. And I was really fascinated that they had something called emergency linguistics. And I think there was a particular university that was asked to come and support this team. And within 48 hours of arrival in Wuhan, they came up with a handbook and a guidebook for medical teams. And the handbook was supposed to facilitate doctor-patient interactions. And it sort of included some keywords, around 76 sentences and 156 words, which were anticipated to be commonly used in diagnosis and treatment. But the good thing they did was that they translated it into different dialects that are used across China. And what they subsequently did, they created the handbook and they created that tool for the guidebook for medical teams, but they then very quickly transferred everything onto the web, and they use something called WeChat. Now, I'm not familiar with WeChat, but I'm sure it's a social media platform. They used video clips. They used TikTok. I'm very familiar with TikTok nowadays, as my children seem to be creating a lot of TikTok videos. Since everyone is in lockdown, children are finding ways to be more creative. So they actually used TikTok. They set up a 24/7 telephone hotline and made copies available as pocketbooks, as infographics. And they then went on to translate all of that into 20 other languages, which are not commonly spoken in China, but they were catering for their international students and international expat community who were stuck in China and couldn't leave. So they actually had the foresight to do all of that, and they did that at speed, and that really fascinated me. So I think that's probably where that got me thinking. I to have been practicing public health at the times of the Ebola crisis in 2014-16. And subsequently, there's a really, really good book that I recommend to people if you've not read it. It's called Getting to Zero, and it's written by two a British and an Irish person who were actually there on the front line. One of them worked for an NGO, and one of them was a British civil servant, and they got together and wrote this really fascinating book. And the key lesson that came across in that book time and time again was the importance of language and how they failed to communicate with their communities in a way that the communities could understand them. And that actually led to what they call deadly ignorance, because people lost their lives. And if the communication is not being communicated, or the language that's being used is not being understood, the repercussions are huge. So I'm just going to pause there. And Saad and Asma, if there's anything that you would like to come in with, or sort of any questions you have before I sort of carry on.
Thank you, Dr. Samia. That's fascinating. This piece that you talked about, the rapid or emergency linguistic response in China, I had not heard of anything like that. And the fact that this has been highlighted in the words highlighted in the Ebola crisis, that's really interesting. Have you, in your work in the UK as a public health professional, have you, given that there's so many diverse communities and so many linguistic groups within the UK, how have you seen this be applied at all during the COVID-19 pandemic, or have these principles been applied at all?
So I think in the UK we have been a bit slower. I mean, we can't compete with the speed that China does things, but we are getting there. I'm not saying that we are there yet, but one of my early experiences is I live in a place called Leicester, which is a very multi-ethnic, vibrant community, and we have a huge Asian diaspora. We've got Pakistanis, Bangladeshis, Indian, and we've got a lot of people who migrated from Uganda, so East African community. And immediately what I could sense was that the government messaging that was going out on the media channels was not really being comprehended by our local communities due to multiple reasons. And I think you can bring in cultural reasons, faith reasons, different contexts and subtexts that are really, really important. And one of the things a local group of local community active group here did was to ask if I could produce a video in Urdu, which is my language. And I was actually overwhelmed by the response I got to that video. It was something very simple, very short that I did. And I then posted it on Facebook, but the amount of people who came back to me and told me how useful it had been, and they were actually sending it back home to Pakistan to their relatives to sort of understand what the disease is in very simple words. How does it spread? How can you protect yourself? And when I've been talking to my own family members and my own people in my own spheres in my networks, the other thing that keeps coming back to me is how people also misinterpret what the advice is according to what they feel it should be, and they bring in their own cultural impositions and their own impositions. I have spoken to people who believe, because they have faith in God and they're Muslims, they think that, oh, they're going to be protected and come what may, God will look after us. And then you've got to make the point that yes, it's have your faith, but you really, really need to take action as well. And also simple things like, when I had to do that talk, the funny thing was, I was preparing that talk in Urdu, and I actually grew up with English being my first language because I didn't really move to Pakistan until my late teens. So then I rapidly picked up Urdu. So there were some subtle words that I was struggling with. So I was trying to translate droplet infection, and it's a hard one. How do you translate it spread by droplets? And then in the end I just used कतरे जो मुंह से निकलते हैं जब आप बात करते हैं या खांसी करते हैं या छींक मारते हैं. So I sort of used that, but I was trying to find the accurate translation for social distancing, and I just couldn't come up with that. It's a tough one because in the UK, the key message that the government has been advising and still is advising is to maintain that social distance. So I'm not sure, Saad, how you would translate social distancing. I actually don't even like the phrase social distancing. I prefer physical distancing because there's no need for us to be socially isolated. We've got so many means available to us. But those were the first few instances. And as Asma said when she introduced me, I also chair the staff network for my organization for Black, Asians, and minority ethnics. And so when you are part of that network, you do understand the barriers there is. I think access to healthcare, I think language is a big access to healthcare, is a big barrier to access to healthcare in peace times. When you're talking about Corona times, it becomes an even bigger barrier. So I think that's probably where I felt that this was really, really important, and we need to do something about it. We have now a lot of organizations, both private and two different languages. I think we've now currently in the UK got key government guidelines translated into over 40 languages. However, I have an issue with that as well, because just translating information into another language, you lose some of the subtleties of the language when you translate it into another language. And I think we're all familiar with that when we try and translate Arabic from the Quran into Urdu or English. You just can't translate it. But I think what there still is a huge need for is the use of more creative ways of using language. So for people who are not very literate, for people who have disabilities, who may not have the best eyesight, etc., it is how you communicate it. And I think, Saad and Asma, that's so key. How you communicate it. Are you just using writing? Are you using pictorials? Are you using visuals? And if you are doing everything on social media, then just bear in mind that the elderly generation may not be so technologically adept. Although I'm really impressed by the elder generation who are really coming on board with social media. But do we give enough thought to how we are conveying the messages? And I think a really important point, and I will pause after that, is also, well, 2 points. A, is it coming from a trusted source? And B, are we culturally sensitive in what we are putting out there? And are we doing it in a culturally intelligent way? Something, I'm trying to think of Pakistan now, so something that you may put out for someone in Sindh may not necessarily translate to someone in KPK in the same way if you look at all the cultural nuances. And very much the same applies in the UK, where we are a very diverse population with lots of different nationalities. So I think it's a bit about how are we sharing that information, and are we doing it in a culturally sensitive way?
If I may just ask a follow-up question with that, and thank you so much for, I think it's a really comprehensive response as to how we need to be more culturally sensitive with regards to the sort of information we're putting out there. And you also mentioned that you've worked with like public health specialists during the Ebola crisis. And I'd really like you to sort of draw a comparison as to how far we've come with regards to being more culturally intelligent with regard to putting out that information to the public. Do you think there has been any progress at all, or what other areas of improvement still are there?
I think we have come a huge way, and one example that immediately comes to mind when I compare Ebola and I compare Corona. Fortunately, Corona is not as devastating as Ebola was. And so we're very fortunate that at the moment we're dealing with a pandemic, which we are able to put some control measures in place for. Ebola was a different story altogether, and for West African countries that suffered that devastation, they still haven't. I don't think they've still gone back to where they were pre-Ebola, because it takes years to then build up communities and the resilience. So one of the key issues in Ebola was about how to bury your dead. And in the West African culture, this was more to do with culture and less to do with religion. So whether you were Muslim or whether you were Christian or whatever religion you were, it was a cultural practice. And it's very similar to Pakistan as well. It's how you see off your dead, your deceased. And you have to do it in a very culturally sensitive way. And in the West African culture, they believed that if you did not give a good farewell to your deceased, their spirits would haunt you for generations. And it's a very important thing to take in, because when all the scientific expertise was brought into West Africa, and there was advice given as to, this is, you're not allowed to wash your dead, you just have to bury them. They used body bags, bin bags. It was a very culturally insensitive way to do things. And I think they did realize the mistakes, and they sort of rectified it. But by then, people had lost trust. And that's why I mentioned trust alongside cultural intelligence. You've got to be conveying the message. The message has to be conveyed by someone that the local community trusts. The government is doing all it can, but we then need local champions to convey that message. Local champions that your local community trusts. So they're able to deliver it in a way that they understand, and they know it's coming from a trusted source. And if I draw comparisons with burying the dead, and I draw comparisons with coronavirus, I know in the early stages of coronavirus pandemic, and when it hit the UK, there was so much discussion going on within the communities about the Jewish communities, the Muslim communities, and some Christian communities about how the dead were going to be buried. And we also know that misinformation and sort of mistrust flourish at times like this. So people were concerned that their dead relatives or the dead bodies were going to be cremated in the UK, and that Muslims and Jewish people of Jewish and Muslim faith would not be allowed to bury their loved ones. So a lot of work had to be done, and the government worked, and public health and the NHS worked with the Islamic Council of Britain and the Muslim Council of Britain, and with all the faith leaders and the Jewish councils to sort of create a really, really good guidance pack around funerals and how they would be dealt with, and what you could do and what you couldn't do. And it was done in a very culturally sensitive way. So Asma, I think some of the lessons we're very fortunate that, yes, we have picked up, but I still think we've got a long, long way to go when it comes to using language in that sort of sensitive, trusted way.
Thank you very much for that detailed answer. We actually, in the comments and questions, one of our participants, Khadija, has mentioned the following, that I worked during Ebola in West Africa, and amongst many other reasons for INGOs and the UN. Challenges, we had great challenges in engaging with the community with respect to a lack of cultural knowledge and sensitivity. So everything that you've said has been confirmed by Khadija here. And she then follows up and asks, during COVID, some countries have not been successful in truly communicating what can keep us safe. An example is the US, which is currently in possibly really the worst straits in the world. What's failed in terms of language and communication in this context where the cultural barrier does not exist, or does not exist to such a great extent?
I think there are a number of things. I do think there are cultural barriers in the USA as well. There are huge cultural barriers. You've got, the USA is made up of a very diverse group of people from all sorts of ethnic backgrounds. So I think there is cultural barrier. Then again, the healthcare system in America is very different from that in the UK, and of course in Pakistan it's different even more so. But it depends who is giving the message, and if the message is evidence backed, and if it is evidence backed, how are you then translating that message into layman language so the average Joe Blog on the street can understand what you're trying to tell them? And I think another thing, and I'm not talking about the USA, but I think this is applicable to all countries, is that there has to be the one truth, and that is the message that has to go out. If you have got different versions of the truth going out so you've got different messages going out by different states or provinces or regions, and you don't have that one universal message that you want to go out in that country, that can often also cause a delay in understanding the message. And so I think from in Pakistan, I know that there was huge pressure on the government to open up the areas of worship because of the holy month of Ramadan. And I know that because of that pressure, correct me if I'm wrong, but I think the mosques have opened for congregational prayers, Tarawih prayers in Pakistan. Am I right?
Yeah, there have been a lot of there have been a lot of rules that the government has set down. They released a paper with rules that the mosques have to follow, but they are open as far as I know.
Yeah, so there was a lot of pressure on the Pakistan government to do that, and I think what people probably have not comprehended is that this disease, coronavirus, yes, we know it's an invisible virus, because I've seen reports from Pakistan and footage of Pakistan videos that the member of the public, there was a picture that was released on social media about people huddled outside a particular office. And when someone interviewed them, they were saying, "What coronavirus? I can't see it. Where is it?" Everything is normal. And just because you can't see something doesn't mean it doesn't exist. And secondly, has the message really trickled down to the common man in every sort of layer of society? Because not just the common man, I've also heard contrary stories about people having huge sort of parties and stuff in private settings. And is the message being conveyed? Do people realize that coronavirus is fatal, can kill you? I mean, 80%, we know that over 80% do recover, but for the 20% who don't, it's a very sad story. And I think the importance of, you're not just doing it to protect yourself, but you have a duty of care to protect others. So when you're observing the physical distancing, social distancing messages, when you're observing the quarantine messages, basically we all have a duty of care to protect the more vulnerable people in our society, the elderly, the ones with comorbidities, who are immune suppressed, the pregnant, so it's not just about yourself. And I think that message really, really needs to be sort of, it really needs to infiltrate all levels of society. So I can't really comment on the question about America, but I think language plays a hugely important role, but it's probably not the only role. And we've seen that some countries have been better than others in curtailing the spread, and it depends on the control measures they've been able to use.
Thank you so much, Dr. Latif. Our next question is from Dr. Aisha Mia. So she asks, how do we speak to public anxiety without losing the urgency and intensity of what we are facing? You don't want to minimize the message and you don't want to scare them. So what's the balance that we strike?
That's actually a really, really good question. And it's something that we sort of always have to deal with at our end as well, because you want the communication to go out in as accurate a way as you can. But at the same time, you need for there to be some reassurance around the message as well, so that you are reassuring the community. So what we tend to do here is that we sort of, and I think everywhere, anyone who's a communication expert knows that you say what you want to say, you say it again, and you say it again. But so we give a very clear message. It has to be short, concise, punchy, but you also have to set it in a context where you are reassuring the public so as not to increase their anxiety. So along the lines of that, we are doing everything and all measures have been put in place. However, it is very important that you do X, Y, and Z, and then you repeat that message. But you've sort of couched it in that, we have put measures in place. We are doing everything that we can. So just to allay that anxiety. So the message always has to be reassuring as well as factual. So that you don't lose the gist of the message. So, coronavirus, we know that over 80% of people do recover from coronavirus, and for them it's a mild disease. However, for the 20% that it's not, it can actually, it can be fatal, and this is what you need to do. And I think we need to draw on community engagement and community spirit. If people are given the ownership that, look, you have a role to play, your country needs you, something motivational along those lines, people, generally the human psyche tends to accept that, and they'll take ownership. But if people don't have any ownership, they feel that things are being done to them and that they're not part of this whole discussion. So I think community engagement is very, very important. It's hugely important. And then learn from what, when you engage with the community, learn from what they're saying. The other important thing, I think, in the use of language or in communication is also listen. How good are we at listening at what the people are saying? So listen to what they're saying and then take that on board and then see how you can answer that.
Thank you very much for that. I think that piece about listening is something that we often fail to remember. So before I move on to the next question, I just wanted to touch on this bit about listening. So have you encountered or have you seen systems in place for that public listening to be formalized, at least in the UK and in other places?
So That's a good question, Saad. Yes, we do. Well, I say peacetime. So when we were not in Corona times, if we consider ourselves out of the pandemic for a minute, we have various consultation exercises that we do. So for any new bill or law that the government puts out, but also likewise for any public health measure that we're going to put out, or an intervention that we're going to introduce, we often have we'll have a pilot period, and then we have a consultation period where we consult with those people who are going to be directly affected. So if you are thinking of installing, for example, you want to install some playground equipment in a park or in a school playground, we will consult with the people who are going to be using that equipment. So the children, the mothers, the childminders, the general public, people who use that park for walking, for dogs, for people who have pets. So we'll consult, and usually these are open consultations, and those messages are taken on board. Now with corona virus and the pandemic situation, you don't have the luxury of time, and some messages are urgent and they need to go out urgently. However, even within the coronavirus and the COVID sphere, there are things that there are tools that you can use to listen to people. You read social media. Social media is a really good sort of gauge for tracking what the general public is thinking or saying or feeling. And our comms team will normally sort of keep an eye on social media and track anything of importance that's highlighted there. Then if that's being raised, if a certain concern is being raised, then we'll sort of think of how do we address that, and how can we address that in a way that is understood. And I think a lot of our information dissemination needs to be done not just culturally sensitively, but also in a way that is meaningful. So for the elderly, you may want to have really good tailored messages on the radio, because maybe you've got elderly people who are listening more to the radio. And then for the young people, you've got your social media channels, and is there a government social media channel that you can disseminate that information? For those people who are learning disabled, has there been any translation into sign language, for example, and has that been conveyed and disseminated? Also, probably television, we all know, newsprint, and sort of what campaigns are going on. So we have numerous campaigns at the moment in the UK, and until a couple of days ago, it was stay at home, protect the NHS, save lives, and that's sort of slightly moved now to being more alert and that. But those social messages are conveyed through lots of different challenges. You'll see them if you're driving for any essential reason. You'll see them on billboards, you'll see them on websites, you'll see them on the TV, you'll hear them on the radio, you'll see them on all on social media channels. So if you have one key consistent message, make sure it's disseminated through lots of different forums.
Thank you for that. The next question is actually, you've touched on a number of points in relation to that. You started with talking about peacetime. The next question from Dr. Murad, he says that you gave the example of China and asks, what are the differences in principles of communication in emergency situations versus outside of emergency situations or in peacetime? Are there any differences, or how should we think of communication in these two types of situations?
Right. I don't think there should be any difference. The underlying messages that go out and the language that is used and the ways of communication should be equally applicable in peacetime and in non-peace times. However, I think what I sort of took home from reading up about what China has done was that if you have a workforce that is ready to be galvanized, you need to know who those people are. So I hadn't even heard of these people called, what are they called? Emergency linguistics and social linguists. And to me, that was like, okay, so who are the social linguists that we can draw upon in the UK? Where are they? Who are they? And knowing who they are, knowing where they are, knowing how you can draw upon their expertise in a very short time scale, I think it's very, very important for non-peace times. And this work really needs to be done in peace times. You need to do a lot of your emergency preparedness and planning work in peacetime, and we do a lot of that in the UK. However, one of the things I think I am going to take forward when we do future emergency planning exercises is, have we considered language and how we're going to use it, and who can we draw in? And it has to be someone who has the experience and the expertise, and then you ask them to work with you. So I think it is knowing who they are and where they are. The other important thing about, if you want your communication to be effective, it needs to be done in a timely manner. So time is of the essence. It needs to be accessible. And we've talked about the different formats you can use and the different channels you can use. It needs to be credible. So it needs to be from a trusted, honest source. It needs to be open. You need to be open and transparent with your communities as well. And I think one thing that I learned from our behavioral science unit in England was you need to give people a message in which there is something they can action. And a very simple example, and this is not to do with coronavirus, but I was trying to see how we could improve immunization uptake in ethnic minority populations in the area where I work. And when I spoke to behavioral change unit, other than the language and the sort of letter that goes out to parents and what we do in the media, they mentioned something very simple. They said, leave the parent with an action they can take, even if it is a little slip of paper that they can tear and stick on their fridge, and they can then tick. Make an appointment, call your GP practice, make an appointment, book children. And it gives the parent something to do. So any message that you put out there, it needs to be actionable as well. Leave them something, a message that they know what to do and how to do it. So something they can do. And then we've already spoken about the message needs to be understandable. The WHO website has a really good information resource on making communications understandable, and something that they try to adhere to as well when they're working with different countries. So I would recommend people look that up, and I can send you the link later if you want.
Thank you, Dr. Latif. So I just wanted to ask a follow-up question before I take a question from the audience. So you spoke a lot about sending out a unified message, to the public, so that it just shows how united the government is. But in a situation such as the COVID-19 situation, wherein the situation is changing at such a rapid rate, the messages that are going out are also changing, week by week. And so even though they're sending out a cohesive message, it's just the nature of the situation that sort of causes this sort of confusion that when is the lockdown going to lift? Because we were told that the lockdown is going to lift on June 1st, and then it got delayed to July 15th. And so because of the nature of the situation, there's so much of confusion. So what sort of strategies should these people take while sending out these sort of communication messages, just to make sure that the public's calm, but at the same time, adapting to the changing situation?
Well, I think the key thing is that whoever the communicator is needs to be, they need to be open and transparent. And I'm not just talking about governments, I'm talking about healthcare systems as well, and people in communities who have some influence. So you need to be open and transparent. We are all aware that this is a rapidly changing situation. As healthcare professionals, we struggle to keep on top of the guidance. Believe me, one day we've got one set of guidance, and by the time we've tried to implement it, there's yet another set of guidance. And we really do struggle with that. But there are some things there's some underlying messages which have been consistent, such as how the virus spreads, how you need to stay, that we have this physical distancing, social distancing messages of stay 2 meters away from someone. And the hand hygiene and respiratory hygiene message, that has not changed at all. So wash your hands, 20 seconds, warm water and soap is the best thing you can use. I know a lot of people, sanitizers ran out of stock and everything, but hand sanitizers are only for areas where you don't have access to running water and soap. Nothing beats running water and soap. And so the hand washing message, the respiratory hygiene message, which we sort of convey as use a tissue to catch your cough or your sneeze and then bin it and then wash your hands. And that actually draws on a very well-known campaign in the UK that is used nearly every flu season, about catch it and bin it. So it's about catching your cough or sneeze. And if you don't have tissue or a handkerchief, and if you have a handkerchief, please make sure you wash it. Then you sort of cough or sneeze into the nook of your elbow like that. So that those clear messages haven't changed. So there are some underlying messages that I think we need to persist with. They haven't changed. Now, whether the lockdown is going to end on day 1 or day 2 or day 10, I think no government is able to give a definitive answer to that until they have all the evidence at hand and they're able to make an informed decision. So for those sort of messages, you just need to take the nation into your confidence and say, look, this is a rapidly changing situation. We are doing the best we can, consulting with the best advice and advisors and experts. And as soon as we are able to make that decision, we shall let you know. But it is very much a movable feast at the moment. So it's very hard. But there are some underlying messages I think that we need to stick to, which are the consistent messaging. And then these other messages can come at a time when, the government is ready to make them, or the healthcare system is ready to make them.
Thank you. So our question from the audience is, what is the importance of underlying unity and social cohesion for the public messages to be accepted by the public?
So in an ideal world, yes, we know that you want social cohesion and you would rely on that for the message to be accepted. But we live, unfortunately, we don't live in an ideal world. So in order for the message to be accepted, I think most of the points that I mentioned before would be applicable. So make sure it is tailored for that community that you are trying to target. It is culturally sensitive for them. So whether it is being done in Pashto or Sindhi or Balochi or Saraiki or Mirpuri or Punjabi or Urdu, the national language is Urdu, but then we have all these variable dialects, and so to ensure that the message is being translated into all of those dialects. And if it is a TV campaign, the visualization of that campaign should be culturally sensitive to that province or region. So it should look different for Sindh as compared to KPK, as compared to Punjab. And, use familiar language, use simple language, familiar words that are common in their dialect, that they understand, and perhaps familiar faces from their community. It could be, I think celebrity endorsements often help as well. So if you have some, well-known celebrity from that area who is also endorsing that message in a very clear and concise and simple way, that often helps as well. So it needs to be tailored to the audience you are targeting the message to, and it needs to be done in a culturally sensitive way, and the language needs to be very simple. And if at all, if you can use pictorials and visuals, they're often, a picture says 1,000 words sort of thing. So they're often more easily understood by people who cannot read and who will find it difficult to understand the written text. I'm not sure if I've answered that question, but that's a tricky one.
Yeah, it was. So just to follow up with that, you initially also spoke about the importance of local champions to disseminate the information that the government, gives out. And I would so one of the fears that is associated with that is that the information would be too decentralized, and therefore there's a higher chance for misinformation if there are too many local champions that the government isn't able to control. So perhaps if you could, give examples of how other countries have used local champions and have really
Yeah.
controlled the message that is going out at the grassroots level. I think that'd be great.
So when we talk about local champions, it's about identifying someone that people in the community trust, but it also has to be someone who has credibility, so that the government or the healthcare system or whoever the person is who wants that message conveyed trusts them. So if it's a credible source that is trusted on both sides, and it is a clear, simple message, the fear of misinformation should be allayed by that. I can sort of give an example of, and this is not from not a coronavirus example, but in the UK and in a place where I work, we were dealing with an outbreak of tuberculosis, and I know tuberculosis is very, very common in Pakistan, but we do see it in England. If it has not occurred in the white British population, it is often it will occur in people from Black, Asian, or minority ethnic backgrounds. So we were dealing with a particular workplace setting where there was an outbreak of tuberculosis, and the language spoken by a quarter of the workplace population was not English. It was another language. I'm not going to say which language it is for confidentiality reasons, but it was a language that I had never heard of before. And it was a mixture of two different languages, and it was an international language. But so what we did in that circumstances was we identified someone who worked in that workplace setting. So people knew that person. They worked in that workplace setting. They were familiar not only to the staff, but also to the management. And the management and public health worked with that person. We got some material translated into their language, and then we asked them to communicate that information. So you sort of do it in a structured way where you are training. It's almost like a training the trainer sort of approach, where you are training that person. This is what we would like you to say. And because it is coming from them, it was then more easily accepted by the workplace population. And so they sort of acted as a go-between for us. So not only did we translate the language, the information into that language, we also used a local person, and you can call him a local champion in this regard. There was someone who was a member of staff who worked in that workplace. So they were trusted by both sides. So that's one example. And so similarly in coronavirus, I think we worked with different faith groups, different ethnic groups. You would have heard that in the UK, the number of Black, Asian, and minority ethnic healthcare workers and people dying of or being affected by coronavirus is disproportionately high in this group. So the government has asked for an investigation and a review to take place, but they have taken on board, advice and consulting with people from these backgrounds, so that they're very much part of that group. So you need to consult and engage with whoever that person is, but they need to be a credible person.
Thank you. That's an excellent point. I think the necessity to use community or cultural ambassadors is often overlooked. And we've received a comment as well from our colleague Khadija, who was talking about her experiences regarding Ebola. And she's mentioning the same thing exactly, that without their local cultural ambassadors or champions, they would not have been able to be nearly as effective as they were.
Definitely.
So we're approaching the end of the hour. I would like to invite Dr. Aisha Mia to make a comment or ask a question if she has one at this point.
Assalamu alaikum, Samia, and thank you so much for joining us today. So my question, Samia, before I start thanking you profusely for being here, my question is about leadership and the communication, the tone that leadership needs to use. So without taking names, because we all know the leaders that we'll be talking about, there are some leaders who've done an absolutely brilliant job of taking care of their communities, of their countries. And what they've done is really just worked around honesty showing their vulnerability in some ways, but with a space of that we'll do whatever we need to do, and with a lot of compassion. And then there are others that really, I think, if anything, have raised significant amount of anxiety and depression and anger, and sometimes even just really foolish acts within their people. So would you speak a little bit, because you are in that space and you may be talking to leaders in terms of, and they may be consulting you all as to, what kind of tone they would use. Speak a little bit to how important is it, the kind of tone that leadership takes, and because there may be those amongst us that might be doing it for other people, and what works.
Yes, and I'm so glad, Aisha, that you actually picked on that point, because I had it in my mind and I don't think I've even mentioned it once. So apologies, everyone. But I think what you say is important, but even more important is how you say it, and that is the tone of your message. And we've talked about making it accessible and easily understandable. But if it comes from someone that the people trust, someone who is in a position of leadership, and it may not always be the person that you think is the leader. You'll be very surprised, but people are in positions of leadership even though they may not realize it. So, for example, I may be in a position of leadership in my own household, to explain the message and convey it to my family, and so on and so forth. And so it has to be a trusted person. The tone has to be appropriate and according to the message you're delivering. So if it is a message of, if it is a serious and a grave message, your tone has to be serious. However, what you said and what you very rightly picked on was allowing within that tone is allowing for human compassion, and also for not knowing all the answers. And when you don't know all the answers, you have to be brave enough and you have to be honest and open. Look, you don't know all the answers, but we are trying our level best and our hardest, and we are learning from other countries, because different countries in the pandemic are at different ways, different phases of, some people are here, some are catching up, some have gone over their curve. So we are learning from the countries that have been where we are. We are trying to do what we can, and we really, really would like you really want them to take some ownership, and you want to motivate them as well, that we really need your help. It's almost like the slogan that we used to see, that your army needs you. And it was a very powerful slogan that was used in the West, where you had the song that, your army needs you. It's that sort of a message where you are treating your audience as your equivalent. So it is that level of trust that, look, we're both at the same level. This is how much I know. This is what I'm sharing with you. And this is what I would like you to do. But also to sort of have, if it is good news, your tone will sort of mirror that. And if it is serious news, your body language. And I think body language, when our leaders come onto television, we all know that what people take in is only 10% of what they say. About 90% of what you take in is people's body language. And that's really important in how they're delivering that message. And so even when our Prime Minister is addressing us, we're all sitting in front of the television. And it's really interesting that my kids will take in different messages. I will take in different messages. My hubby will take in a different message. So we all see things and perceive things according to our own, mindset. So, but what uniformly is coming across by those leaders who've done a really, really good job. And there was a really good, I think it was on Twitter, there was a really good comparison of a few of the world leaders. It was really interesting. But the one key thing that was common in the good leaders was, amongst the leaders who were perceived as being good leaders, was that they had a clear message, they were open and they were honest, and they used the right language. So I think that was consistent. Whereas we have seen some leaders, whether there are leaders in government or leaders in different systems that you work in, where you are giving a really gobbledygook message and your body language is not aligned to what you're saying and the language you're using is very complicated. We know that that's where leadership sort of falls down.
Wonderful. And it might be completely politically incorrect. I'd like to believe that is true. What do you think about most of the effective leaders that are coming out being women? And there's a lot of articles out there that somehow they and is it? I mean, I've been thinking about it, and I don't think that we have enough data to kind of say that this is because they were women and stuff. But I think that perhaps whatever the situation demanded, the natural way that women communicate has probably ended up being more sort of effective in some ways than not. Do you have anything? I know that you lead the Women's Global Health chapter for the diaspora in England. Any thoughts on that?
This is something very close to my heart. Unfortunately, I don't think we have enough data from the coronavirus experience about gender-based leadership, but we do have a lot of evidence, I think, in other spheres where gender-based or women communicating a message can be seen as very, very effective. I think women tend to be naturally, and I don't say this with any disrespect to the opposite gender or genders, but women tend to be more compassionate, and they tend, being in the role of mothers, they tend to sort of have that nurturing role, and therefore they will look after their flock that way, and so that comes across in their messages, and I'm pretty sure I know who you're alluding to, but everything that we have seen of this female leader has shown this leader not only to be in a position of leadership, but we've seen her vulnerabilities as well, which makes her more human. And so anyone who is more human, and I'm very pleased to see that we are seeing that in other, in not just female genders, we are beginning to see that in the male gender as well. So it definitely, there definitely is some work to be done here, Aisha. Maybe we can do some sort of a study afterwards to see what role. Yes,
that'd be wonderful. Well, thank you so much, Samia. This was really wonderful. Thank you for coming and talking about such a key area, and picking up that this is a need of the day. And I'm sure all of our audience really enjoyed having you. We loved having you at AKU. I hope this is the first time, but not the last time. So we'd love to have you more. And I know you had an exceedingly busy schedule. You're right there in the front line. So taking this time out for you, really appreciate it. So you take care.
It's an honor.
Yeah, thank you for joining.
It was an honor. It was an honor. Thank you for having me.
You take care.
Thank you so much.
Thank you, Sadhana, as well.
Take care. Thank you, everyone.
Yes, bye.
Bye-bye.